COVID-19 has divided the world, most recently between the vaccinated and unvaccinated. Many American companies, from Google to CNN and United Airlines, have made the vaccine compulsory for staff. The alternative: look for a new job. In Germany, free coronavirus tests are coming to an end. Unvaccinated Germans will have to foot the bill if they want to eat out or go shopping. In France, 250,000 people protested against tightening rules against the unvaccinated. They say liberty is at stake. It's their body, their choice.
I'm Ben Fazul and welcome. The French government is trying to speed up its vaccination drive by making life for the non-vaccinated more complicated. Access to trains, domestic flights and restaurants and bars will only be allowed for the fully vaccinated, recently recovered or negatively tested.
A year and a half after the pandemic began, restaurant owner Sylvain Belot is facing yet another obstacle for his business. The new health pass could make an already difficult year even more of an uphill struggle, he fears. I'm in favour of the COVID-19 vaccination and all of our staff will soon be fully immunised. But I'm worried, as we'll surely lose some of our clients. Not all of them will want to get vaccinated or a test done every 48 hours. And our turnover is already 30% below what we usually earn in July, as there are less tourists than in normal years. The announcement of the mandatory health pass comes just 2 months after Sylvain was finally allowed to fully open his restaurant following months of lockdown. At the time, he felt optimistic. We are delighted to be able to welcome customers back inside and not only on the terrace. This gives us an additional option when it's raining. And it's great that the curfew will be pushed back and eventually lifted. Sylvain is not the only one concerned about the new measures. Tens of thousands of protesters have been taking to the streets over the past few weeks, demonstrating against what they say are restrictions on their freedom.
But polls show that more than 60% of the French are in favour of the health pass. 74% approve of compulsory vaccination for health workers.
And only between 35% and 40% support the demonstrators. Since President Macron's announcement, the number of daily COVID-19 jabs has skyrocketed, especially amongst young people. And yet, many of them say they don't like being put under such pressure. Some of my friends don't want to get vaccinated, and that's why we'll continue to meet at home or somewhere outside. The French government says the health pass is to only stay in place until herd immunity is reached. But for now, just over 50% of the French are fully vaccinated.
Peter Newman is a professor at the University of Toronto and joins us from Bangkok. How much of a threat is this unvaccinated portion of the population to those who've had the jab, considering COVID-19 and its vaccine is extremely effective?
Well, clearly the first and foremost risk is to themselves. I mean, that, in my understanding, the vast majority of people who are now not necessarily only contracting COVID, but getting sick and potentially dying of COVID are the unvaccinated. It's become an epidemic of the unvaccinated. Secondly, however, of course, they're more likely then to be passing on the virus to other people because they're more likely to become infected. So it's not merely a personal choice. It's a personal choice that, of course, affects the lives of a lot of other people.
So should the unvaccinated be punished?
From my perspective, in terms of social psychology, social work, that's not the way I would start. I would start with more complete steps to ensure that everyone has access, that it's convenient for everyone to get vaccinated, make it open, do things to promote the vaccine. Because I'm very, very much pro-vaccination, but my problem with using a sledgehammer right away is that you're going to further polarize some people who are not anti-vaxxers. They're among the vaccine hesitant who could potentially be convinced by a number of factors to become vaccinated. And if we come down so hard right away, and mandate it, it's going to create even more of a political issue out of really what should be purely a public health issue in terms of saving our lives and other people's lives and our families.
Sure. Not that many governments have taken out that sledgehammer, though, yet. They're giving people the choice of getting vaccinated or getting tested. But there are some who are going for the vaccination-only policy. Is it too soon for that? Is that what you're saying?
Well, quite honestly, I mean, I can't judge for each country. I mean, it really depends on where they're at. I mean, from my own perspective, yes, there could come a time in any given scenario where it's getting so out of hand that the only way to control it is to mandate vaccination. So I can't say exactly where is country X on the spectrum, but I can say it wouldn't be my choice of a first policy to start with is a mandate. Again, if this is so good, why are you mandating it? Like, people should be able to make a decision and come to, by and large, the correct choice. Now, if, after some period of time and new infections, and still more importantly than new infections, people still getting very ill and some people dying, there may be no choice. But from my perspective, at least in the situations that I'm more familiar with, we don't start with mandates.
Peter, haven't we already reached that point? I mean, the Delta variant is really making its mark, even in places like Australia, where they had things under control. But their strategy of shutting off from the rest of the world just isn't working with a more virulent strain. You've said mandating vaccination can risk turning a highly effective and routine public health intervention into a contentious battleground. But on a social level, haven't we already reached that point? Look at the protests around the world, these huge crowds that aren't meant to be gathering during a pandemic.
Yes. I mean, again, I think we probably have to particularize it to certain countries, certain places. It's different. And I really don't think there's a one-size-fits-all response, across the globe. But the original piece that I had written, for example, about college students, university students, was understanding the fact that they'd been gained access to the vaccine later, understandably so. I mean, they're not of age where it's so potentially lethal, and that there are many ways to start first. So, I mean, certainly not in all populations. And I mean, you may get to this soon, but the other challenge I have from the perspective of a very multicultural society is there are some groups who are disenfranchised and have been so for, quite some time. And they've been also borne the brunt of some very unfortunate health mandates. Now, clearly, that's not where the COVID mandate, vaccine mandate is coming from, but they have understandable hesitancy. That's not being a rabid anti-vaxxer. And so that I believe that for these communities, it's much more, a more metered approach where you start first from understanding that first, people living in more poverty, people who are somewhat marginalized from the economy, are probably less access to the vaccine to start with. So let's make sure they have full access. Let's make sure to meet with respect their concerns based on histories of being maltreated by the healthcare system. So they're not coming from a complete crazy conspiracy theory. They're coming from lived experience.
OK, we'll have to leave it there. Peter Newman, thank you very much for joining us. University of Toronto, great to have you on the show today.
OK, thank you so much.
Now to that part of the show with Derek Williams answering your questions on the coronavirus.
How does the refusal to be vaccinated correlate with an increase in mutated virus?
This question is one that anyone refusing a vaccine needs to think about long and hard. To try to answer it, let's first go over some basics that everyone should be able to agree on. Number one, Like all viruses, SARS-CoV-2 regularly mutates, producing new versions of itself that we call variants. That's not up for debate. Number two, more of those variants will, of course, appear when more people are infected. Three, the chance that random mutations could alter the coronavirus for the worse, like making it, for instance, more contagious or more deadly, that chance rises along with the number of people the virus infects. So four, logically, to limit the chances of even more possibly dangerous mutations arising, we have to limit viral spread to new hosts, effectively limiting how often the virus replicates. The vaccines that we have appear to do that very well by making recipients a lot less likely to catch the disease, which is why the choice to be vaccinated is not just a personal one, but a social one as well. Even if you say yes to vaccines, you could potentially become infected, but the chances are much greater if you say no. Which you might consider to be your choice and your right, but it unfortunately doesn't stop there. That choice not only poses a potential danger to other unvaccinated people around you, which is bad enough, it also potentially offers the virus more opportunities to mutate into something possibly even worse for all of us, like a variant that's resistant to current versions of our most powerful defense against it, vaccines.